Hello David, how are you?
Hi Ruth, I'm very well, thank you.
So, I know you as David, but other people might know you as David Hillson, the Risk Doctor. Why is that?
Yes, the Risk Doctor, it's a great name and a great brand, I think. It tells us a lot of things. First of all, it tells you that I'm interested in risk, so it's the Risk Doctor. But also the doctor idea, I think, has some very useful concepts linked to it. So doctors are involved in consulting, they're involved in helping people who have problems that need to be addressed and fixed. We have the idea of a health check, of making sure that people are healthy and staying healthy. And all of those ideas of consulting and diagnosis and treatment are very linked to the world of consulting in terms of risk consulting, which is what I've been doing for, 25 years, no, 30 years now, and the company's doing as well, the Risk Doctor Partnership. So the medical metaphor is quite useful as the risk doctor, but doctor also tells you something else. The doctor is a trusted professional, somebody who's an expert in the field, somebody that you go to if you've got something that needs addressing. And we hope we've reached that position in the field as well.
Okay, so that makes sense. But the medical metaphor specifically, that's the theme for this video series and I think also for your latest book.
Yes, over the years that I've been consulting in risk management and others in the Risk Doctor Partnership, we've found people coming up again and again with the same problems in the way that they manage risk in their projects and their businesses. And so you get common problems, and of course we've developed well-proven solutions that work to address those problems. But I was wondering if there was a better way to share those solutions than just waiting for people to come up and ask us again about the same thing. So the idea of the book was to capture those common solutions, those well-proven treatments for common problems that people have managing risk. So we used the medical metaphor to say, in fact there are 10 common risk ailments. And a risk ailment is a problem that you have in the way that you manage risk. We can identify diagnostic symptoms, so you can tell if you've got it. We can talk about a prognosis, so where is it leading you if it's not treated. We can offer you cases of other people who have suffered from the same thing, and then treatment options of the way that this particular risk ailment can be treated. So the idea is of 10 common risk ailments with proven solutions that people can put into practice if they have them themselves.
Okay, so that's neat, but you're not talking about real medical problems, are you? I mean, obviously, you know, people really suffer terribly from real medical ailments.
No, you're right, that's a very important point to make. It's a metaphor, so we're using the real physical ailments as a way into talking about risk ailments, about the problems that people have in managing risk on their projects and businesses. And so we're not trying to belittle or deny the very real problems that people have with these actual physical ailments, but the idea is that it's something people are familiar with, and then we can use that as a way into, and it's all about talking about problems with managing risk. So we're just using it as a way in.
That's good. So maybe you could give us an example then of one of the common risk ailments.
You know, when we have situations where people understand what the risks are, but very often they have problems communicating those risks to the people who need to know. And we've called that risk muteness. So mute is somebody who knows what they want to say, they have a message, but they can't communicate it, they can't get it out. And I find that, and I'm sure you do too, very often, that project teams or somewhere else in the business are people who know what the risks are that could affect the business achieving its objectives, but they just can't get that message to the people who need to know. And the purpose of risk management is to focus attention and to help people to take action. So if the people who need to pay attention and take action don't get the message, then risk isn't going to be managed, which leads to avoidable threats turning into problems and opportunities that could have been captured being missed. So risk muteness is an inability to communicate about a message, the message of risk which you know.
That's really clear. So if someone or an organisation believes they're suffering from risk muteness or indeed one of the other ailments, what should they do?
Well, they need to find out more about the ailment that they might be suffering from. As you mentioned, we've covered that in my latest book, The Risk Doctor's Cures for Common Risk Ailments. And there's a chapter here, 10 chapters, one for each of these most common risk problems. And in the book we talk about diagnostic symptoms, prognosis, cases and treatment options. So people could read the book and self-diagnose and then understand what treatment steps they need to take. Also, I speak often at conferences and in-house events around the world, and I can speak on one of these risk ailments in more detail if people are interested in exploring a particular ailment. And then lastly, the Risk Doctor Partnership as a consultancy firm helps real organisations who want to address these things in practice.
Great, and we're going to learn some more about some of the ailments in this video series.
Yes, we are.
It's a really fascinating approach. I'm looking forward to hearing more about it. Thank you, David Hillson, the Risk Doctor.
Thank you, Ruth.